The mouth consists of two parts. Firstly, the vestibule refers to the area between the teeth and the mucosal inner lining of the cheeks and lips. So this goes right around the mouth on all aspects around the edge apart from the posterior. And the oral cavity proper is the area within the teeth, the upper and lower dental arches, and filled by the tongue. So the oral cavity proper is bounded laterally and anteriorly by the gums or alveolar arches with their contained teeth on the maxilla and mandible. Behind the mouth there's a small constriction or constricted part communicating with the pharynx called the isthmus falcium. The floor is soft tissues and the roof is the hard and soft palate. The hard palate is the front and the soft palate is the bit at the back of the roof. This is a cross-section, a coronal cross-section of the mouth, with the maxilla and the mandibles here shaded in yellow. Up here is the nasal cavity, and these are the maxillary sinuses. The boundary of the vestibule medially is the buccinator muscle, and its action is to flatten the cheek or hold the cheek during chewing. Now the body of the tongue that you see would actually be here, and these muscles underneath it are the ones that move it, but normally these aren't visible unless you lift the tongue up. This is a fan-shaped muscle called the Genial Glosses, innervated by the hypoglossal nerve and supplied by the lingual artery. It's the largest part of the tongue and is responsible for sticking the tongue out of the mouth. Just below it is the geniohyoid muscle, and that's also innervated by the hypoglossal nerve. Genio meaning chin and hyoid referring to the hyoid bone in the neck, and it's responsible for opening the airway, assisting respiration. This is the anterior belly of the digastric muscle. The other belly extends to the mastoid process. It's supplied, at least in the anterior part, by the trigeminal nerve via the mylohyoid and inferior alveolar nerves, which are branches of it. And its action is to elevate the hyoid bone and open the mouth by depressing the mandible. The posterior belly is supplied by the facial nerve. The mylohyoid muscle forms the floor of the mouth, stretching from the mandible to the hyoid bone of the neck. Again, it's innervated by the mylohyoid nerve, which is a branch from the inferior alveolar. And similarly, its function is to elevate the hyoid and the tongue, which is important during swallowing and speaking. So considering the roof of the mouth, if you take this diagram, the mastoid processes of the temporal bone are here, and this is a coronoid section of the mouth. The styloid here, the sphenoid. The auditory tubes here on the opening of the auditory tubes. The choanai in here, which is just above the nasal cavity. The posterior nasal aperture, it's called. It's basically the part of the nose between the vestibule, which is the end of the nose, and the pharynx, just below the frontal and sphenoidal sinuses. And these are separated by the vomer. This is the musculus uvula, the uvula being the little thing you can see sticking out at the back of the mouth, and the muscles used to tighten it to use in speech. This is the pterygoid hamulus, the more medial. Remember, the pterygoid hamulus are the little bits that stick out at the bottom of the sphenoid bone, just like below the wings. Now the levator palpatine muscle crosses in front of this attaching to the eustachian tube and the temporal bone, which are up here, and the other end to the palatine epineurosis on the roof of the palate. It is innervated by the vagus nerve, linking to its role in swallowing, when it contracts to prevent food from entering the nasopharynx. And behind the pterygoid hamulus is another muscle which also connects or attaches to the pterygoid plate alongside having connected the palatine aponeurosis and the auditory tube. And this is tensor palati. It also helps to prevent the entry of food into the nasopharynx during swallowing by tensing the soft palate. But it's not supplied by the vagus, it's actually supplied by the mandibular nerve, the third branch of the trigeminal. The inner of the roof of the mouth is the palatopharyngeus, and this is attached to the palatine aponeurosis and hard palate and extends all the way down to the upper border of the thyroid cartilage in the neck. It's innervated by the vagus nerve, and it works together with the levator palati and the tensor palati to pull the pharynx upward over the bolus of food being swallowed. The outer muscle of the mouth wall is the palatoglossus and closes the oropharyngeal isthmus, which aids the action of swallowing. Again, it's vagus nerve. The lips are covered externally by skin and internally by mucous membrane. However, the transitional zone between these two, the vermilion border, doesn't have any glands that secretes mucus, so the lips have to be licked to moisten them. The cheeks have a similar construction with buccinator muscle going in between the two layers. The buccinator's function is to push the cheek towards the teeth during chewing, ensuring food doesn't fall into the vestibule. As well as the buccinator, the cheeks also contain the parotid gland and parotid duct, which goes forwards towards the mouth. And immediately behind this, the external carotid artery and retromandibular vein. And in front of it, the masseter muscle, whose action is to raise the lower jaw to initiate chewing with the mouth. The lingual and inferior alveolar nerves run just below it. There are 32 permanent teeth in the adult mouth.